So good afternoon, everyone, and welcome to this community chat of October 6th. Happy birthday to my father. Today's his birthday. So thank you very much for joining us today. And today we're going to be talking about flu shots. Please remember, ask all your questions. We want to make this very interactive. This is a great opportunity for you to ask questions to people who really know. You don't have to ask Twitter. You don't have to ask Facebook. You don't have to ask TikTok. You really need to hear from people who are specialists in the field. So flu season, the cold is already here. We feel it. And now it's time to get that vaccine. And I know that a lot of people are eager to take it, but some other people are like, yay or nay, like we don't know. So today we're going to find out if it's best or not to take it. With us today, we have Sony Rastogi. She is a pharmacist from the Montefiore Nyack Hospital, and Dr. Asymptomatic. I said it's a doctor, but I'm gonna let them introduce themselves so that we can learn about them a little bit more and what they do and who they are. So ladies first, Sony, go ahead. Oh, by the way, I'm Sandra Revalo. I'm Director of Community Health and Wellness. I always feel that you already know that, but you know, in case somebody new is listening, at least you know who I am. Okay, sorry, Sony, go ahead.
Thank you for that introduction, Sandra. I'm Sony Rastogi. I'm an infectious disease pharmacist at Nyack. I have been working here for a little bit over 7 years in this role.
Thank you, Dr. Chak.
Good afternoon, everyone. Thank you very much, Sandra, for arranging for this. It's always an honor and a pleasure being in your company. So my name is Asymptomatic. I'm one of the infectious disease specialists in Montefiore at Nyack. I happen to be the chief of the infectious disease department. And
you just happen to be the chief. Let's see how you say it. He's a very important person. Let me just tell you that. So let's start there, Dr. Chak. You said you are an infectious diseases doctor. What is that?
So infectious disease doctor, we would deal with a whole variety of infections from head to toe, so can be common infections as we mentioned, the common cold. It can be skin infections. It can be, something more serious, such as brain infections, heart infections, so on and so forth. So viral infections such as influenza, such as COVID, comes in the category of infectious diseases as well. So we certainly deal with those on a regular basis, amongst many other infections. So I just gave a very brief overview of it.
And what are infectious diseases? Are there diseases that go from one person to another as opposed to infections that just stay in one body? Like, what would be the difference?
Sure, so that's a good question. So some infections are inevitably contagious. So such as we have witnessed in the last couple of years, COVID infections are considered to be very contagious. So yes, they can pass on from one person to another. Some infections can be on the surfaces. So yes, COVID, influenza, sometimes they can stay on the surfaces and they can be passed on. So yes, some infections are contagious, whereas certain other infections are not contagious. They are, there's different type of risk to get those infections. So if, for instance, there's some skin infections called cellulitis. When you have certain underlying medical conditions, such as, let's say you have diabetes, let's say you have a compromised immune system, you get a little bit more prone to getting that. So those are not contagious. Those are not spread from person to person. They're just inherently there. Some infections are environmental. So there's risk of contracting some of those infections in the environment. Some infections can be foodborne. So if you eat certain foods, your increase of the risk of infections goes higher with those. That's in a nutshell.
I'm just thinking, I have to bring you back to another community chat to learn about all of that, because that was a very quick nutshell and a lot of information right there.
Sure,
so
it'll be my honor.
We want to talk about flu today. Why do we need to talk to a pharmacist, Sonny, when we're talking about flu?
Well, flu shots are widely available at pretty much all pharmacies. So if you ever had any questions about the flu shot, if you should get it, shouldn't get it, any concerns that you might have about it, pharmacist is a great resource, especially because many people do go to pharmacies to get their flu shots every year. So I think that, just we're very easily accessible, sometimes more so than physicians. So I think, it's always good to have a pharmacist around.
Just to reiterate that point, pharmacists have been a tremendous resource and help during this whole pandemic. They were really in the forefront in helping us with the treatment plans with COVID, with the flu vaccine, as Sonia mentioned. They're, for the most part, available readily in the pharmacies. So people can go to the community pharmacies and they will be available over there. And pharmacists have certainly been on the forefront. So just to reiterate that point, for us physicians, they have been a tremendous help during this pandemic and during COVID. With flu season and other infections as well. They're always on the forefront with us.
And I have to acknowledge all the work that Sony and the whole pharmacy team here at Montefiore Nyack has done to also help out in the community, giving vaccines, providing vaccines, making sure that we have enough vaccines for everybody during COVID, during flu, all the time. It's like our offices are across the hallway from each other, and I just need to jump in for help, and they're always helpful. So thank you, Sonny, to you and your team for always being available and helpful. You guys are the perfect team. Okay, flu. Let's move to flu now. And it's very hard to do this talk without talking about COVID as well. I think that COVID just became the norm. Like, we need to talk about COVID, but especially now when we're talking about flu, because I feel that a lot of people are scared, obviously, of COVID. And during flu season, how do we know the difference? When is flu? When is COVID? And physiologically, and also, what will be the main difference between the two?
So sometimes the symptoms are very subtly different. So for instance, with flu, you would get fever, you would get a cough, you'll get shortness of breath, you'll get fatigue, and you would get a runny nose, headache, muscle and body pain. So those are very similar to COVID. COVID, you would have additionally a couple of other symptoms as well. So the ones that were mentioned above, the flu symptoms, you can see them in COVID. In addition, you can get a couple of other symptoms that we don't see in flu. So for instance, people can have a little bit more of sometimes abdominal symptoms. And in fact, I'm sure many of you have heard, fortunately, currently the COVID symptoms are not very severe. So many of the people would always mention that I just feel as though I had a bad flu, whenever they're coming down with COVID. So the definitive way to distinguish between both of them is to do a test. So we do a nasal swab, and then we can get the results available quite rapidly. So that would be the definitive way to distinguish between both of them.
So you do the same nasal swab for both flu and COVID?
It's slightly different. The testing is similar in both. Yes, you will do a nasal swab, but then when you send for the test, it's tested in a slightly different manner by the lab.
Okay, so one test, but two different analyses?
Correct, that's correct.
That's good news, people. Like, we don't have to have that nasal swab done twice. I really love it.
Well, that's only if you are, doing it in like a physician's office.
Okay.
So COVID tests are available in the pharmacy, but flu tests, checking for influenza isn't as readily available. That can really only be done when you are at your doctor's office or in the hospital, in the emergency room. In that case, it would be just one test. But if COVID tests are very readily available to pick up from any pharmacy, and you can test for COVID yourself to see if you have COVID, and if you don't, then it's possible that you might have the flu.
Wow, you just said something very interesting to me. So you can have flu and COVID at the same time?
I'm sorry, would you mind repeating the question again? I'm sorry.
Yeah, can you have flu and COVID at the same time?
Yes, you can.
Oh.
Absolutely. Theoretically, you can have both at the same time. Fortunately, we have not seen many cases of it, but it's certainly possible that you can have both at the same time.
That must feel horrible. Do you need, yeah, imagine, do you need to be hospitalized if you have both? Or do you find most of these cases in the hospital already?
So again, that would depend if the symptoms are extremely severe. So some patients would inevitably be hospitalized for them. But for the most part, whenever you have the flu or COVID, we don't hospitalize every single one of those patients. It depends on the symptoms or the severity of symptoms. So for instance, if somebody has extensive vomiting, high-grade fever, where they just can't even lift their head up, they can't eat anything, so you just want to make sure they don't get dehydrated. So that would be an indication where you would admit somebody, to hydrate them adequately, just to make sure things are normalizing in them. But in a nutshell, you don't need to hospitalize everyone with one or both of the symptoms at the same time.
Okay, that's also a little bit of good news. Now, Sonny, during the COVID pandemic, we learned about these new vaccines or the new way of vaccinating people. Could you please remind us of that, on what's the difference between the mechanism of the COVID vaccine versus the flu vaccine?
Sure. So most of the COVID vaccines are mRNA-based vaccines. So that just, it's a mechanism that has been around for a very long time. It's not anything new to the industry. It's just the COVID vaccines themselves were, I guess, new because, we haven't seen COVID in the past. So with these vaccines, they target a certain protein on the COVID virus itself. And that's how they act. Whereas with the flu vaccines, the mechanism is a little bit different. They usually use inactivated strains of the flu vaccine to kind of help your body build up its immune response, so that your body, if it is exposed to the flu, can act, upon it that way.
Is there worse reaction to the vaccine depending on the type of vaccine, or can we expect the same reaction or no reaction?
It's a good question. In general, I feel like with the COVID vaccine, we have seen a little bit more side effects. Patients have felt body aches throughout the whole body. Sometimes people even feel like, they may have had COVID, once they get the vaccine. But, in my opinion, those side effects usually only last for about a day or two. And for anyone that has had COVID in the past, they will tell you that usually, actually having COVID is a lot worse and lasts much longer than that 1 or 2 days of side effects that you may experience from the vaccine. With the flu vaccine in general, people do usually get achy arms on, the arm that they end up getting the vaccine in. And in general, side effects tend to be a little bit less is what we have seen. But that shouldn't, be a reason for not getting either of those vaccines.
Yes, I would personally vouch for that as well. I've had many, many patients who have shown reluctance, but when you bring up that issue to them, that it's, I'll speak personally on my behalf. Like when I took the COVID vaccine, I was quite ill for about 24 hours, but that was totally fine. It was like nothing happened after 24 hours. So many people have said the same thing. They would much rather get those symptoms for 24 hours rather than getting COVID or getting the flu, and God forbid, getting, ending up on a ventilator, a breathing tube where they can be hospitalized for many, extended period of times. Unfortunately, we have some patients who have had permanent lung damage because of that. So when you bring that up to the patients, it's almost a no-brainer in that sense. The flu vaccine or the COVID vaccine, the symptoms that they would have for a short period of time are certainly well, quote unquote, well worth it compared to, getting the actual disease in itself.
And Dr. Chuck, do you know of any cases of people who need to be hospitalized after getting a vaccine because of the reaction to the vaccine?
We've seen very few. I mean, I honestly don't even remember any case, at least in the last few months, where a patient needed to be hospitalized because of the side effects of the vaccine. We've seen minor side effects where, some people have developed a little bit of the, as Sony mentioned, the reaction where they have the vaccine given. We've seen those type of reactions, but they're very short-lived. A couple of days later, people do respond fairly well.
Mhm. Yeah, I think that's important to know, right? That if we're gonna get the disease, it's gonna be many times more severe than whatever we're gonna feel. Because I know a lot of people say, oh no, I always get sick when I get the flu shot or things like that. Now, in your experience, both of you, and maybe Sonny, you wanna start, what are some reasons that people voice for not taking the vaccine?
So I think you kind of hit the nail on the head with something that you just said. I think one of the common misconceptions with the vaccine is that it's going to stop you from getting the virus, right? So the COVID vaccine isn't going to stop you from getting COVID necessarily, but it's been found to, in patients who have been vaccinated, those patients have been found to have less severe symptoms of COVID. So less of a risk of getting hospitalized with COVID. And, similar to the flu vaccines, although they target specific strains, it's important to remember that viruses keep changing, right? So it's very hard to know when they're actually making the flu vaccine, if, they're going to target what they think is going to be the most common strain based on what they saw in Australia, because Australia, for example, they go through the winter months before we do. So when it's our summer, it's their winter. So they'll kind of see what are the flu strains that Australia saw during their summer, and then they kind of target the flu vaccine or they make their predictions of what we're going to see here based on what they saw there. So, it's important to remember that although these vaccines may not necessarily prevent you from getting these viruses, usually the symptoms that you experience tend to be a lot more mild than people who haven't gotten the vaccine.
Dr. Cha? Dr. Chuck, what have you heard from people for reasons for not taking the vaccine?
Sure. So again, that's a great question. I think there's a wide array of concerns that the people have had. I think it really stems from maybe a lot of misinformation that might be out there. So people would do research from the internet, and so I think we just need to be very cautious about that. I do encourage my patients to look up some information on the internet. However, I do encourage them to go to a legitimate medical website, you know what I mean, where they can get better information rather than somebody's personal blog where they're just coming up with some theories which are unfounded, not medically researched, there's no scientific data behind them. And unfortunately, in this day and age, that information does spread very rapidly, and a person can just take that as the ultimate medical piece of information, and they kind of run with that. So I think it becomes a very crucial role to have these type of webinars that you're doing today, so that people can understand, better from people who, have dedicated their lives, studied this a little bit better, who have seen, people getting extremely sick, as I mentioned, people getting on the ventilator, being hospitalized. So we've seen people doing much better once they're vaccinated and get the appropriate treatments.
Let's move a little bit into contraindications. We are
Sorry, just
supporting.
one other thing. I just wanted to mention that a really good resource, if people did want to look it up on the internet, is the CDC website.
All right. That's true. Centers for Disease Control, very, very good website. And they have a lot of information about all the vaccines, basically. So yeah, thank you, Sonny. Let's move to contraindications a little bit. We are encouraging everybody to take their vaccine. We know that if you're vaccinated, if you happen to get sick, it's going to be a lot less severe than if you are not vaccinated. But there are people out there that cannot get the vaccine. And we have a question here. For example, if a person with Guillain-Barré syndrome, did I say it correctly? Guillain-Barré syndrome cannot have the vaccine for COVID, then what about flu? And are there any other people who are not supposed to take vaccines, or specifically flu and COVID?
So in a nutshell, I think that's a great question. Guillain-Barré has been considered as a relative contraindication for the flu vaccine. For a COVID vaccine, maybe not. Again, you just have to make sure with your physician, if they feel strongly that that might be contraindicated, then follow their recommendations. So as I said, Guillain-Barré could be one of the relative contraindications for a flu vaccine. If somebody had a serious reaction to flu vaccines in the past, that could be another contraindication. Something traditionally that people used to think, if they have had egg allergies, they should not take the flu vaccine. So fortunately, there's multiple or many research done on this. If you're allergic to egg, you can certainly take the flu vaccine. Again, just check with your physician, depending on the nature of the allergy. Sometimes they need to be monitored, but most of the times it's considered very safe.
And that's for both flu and COVID, you're saying, right?
That's correct. So the COVID vaccine is not even contraindicated if you have a severe egg allergy. As Sony mentioned, it was a different mechanism and different ingredients altogether compared to the flu. So, but Guillain-Barré could be somewhat of a contraindication. And again, if a patient or if a person had severe allergic reaction to the first COVID vaccine, that can be considered a relative contraindication as well.
Could it be that one time you have a reaction and another time you don't, or that you have not had a reaction for a few years and then all of a sudden you have one?
Absolutely. I think that's why you need to check and see what was the nature of the allergy. For instance, I'm going to throw this out there. A lot of times patients come up to me and they said, you know what, I'm allergic to antibiotic X. I'm allergic to penicillin, or I'm allergic to whatever. So when you go deeper and you check with them, what was the nature of allergy? Most of them would say that I had an upset stomach when I took it. So we don't consider that as an allergy. That might have been a side effect of, or whatever, something else could have caused, the upset stomach. So I think by case, it needs to be evaluated well. What was the nature of the allergy? And then you take it from there. So obviously to have a discussion with your with your physician, and then they can evaluate that better.
Yeah, and to kind of piggyback off of what Dr. Chalk was saying, there are a lot of formulations of both vaccines, the COVID and the flu vaccine. So, if you've had a previous reaction to, the mRNA-based vaccine, for example, they have a new one that just came out, which is the Novavax, and that mechanism is a little bit different than the ones from Pfizer and Moderna. So that is another option for people who may have had a reaction to that specific mechanism from that vaccine. And same with the flu vaccines, there's a lot of different formulations. All of them are made a little bit differently. So, if you had a reaction to one, it doesn't necessarily mean that you're going to have the same reaction again.
Let's move to treatment now. And we have a question here. If Tamiflu is used to treat COVID successfully. Dr. Cha?
So no, as far as we know, we're not recommending Tamiflu as a treatment for COVID. There might have been a case or two that they got better, but as a whole, it's not recommended as a treatment. Tamiflu is fairly effective against the influenza virus. Again, it needs to be taken rather quickly. It's more effective the quicker you take it, within 48 to 72 hours after your symptoms start. But there's no substantial studies that have shown Tamiflu to be effective against COVID as of yet.
Yeah, so just like antibiotics are made to target, different bacteria, we have antiviral medications to target different viral infections. So for influenza, we have Tamiflu. For COVID, we have Paxlovid, which is the oral medication that you can take to treat COVID for patients who have mild or moderate symptoms.
Is that over the
which
counter?
is just one of the few. Huh?
Is that over the counter? Because Tamiflu is over the counter.
No, both of them are prescription. So Paxlovid is one of the ones that's available as a prescription medication. Similarly, should be started within 5 days of the onset of symptoms for it to be truly effective. And, Tamiflu, as Dr. Chalk was saying, is also a prescription medication that should be started pretty quickly.
Yeah, you're right. I believe the one that is over the counter is Theraflu, right?
That's correct. Theraflu is over the counter, but it's very different than Tamiflu. And because as Sony mentioned, these Tamiflu or Remdesivir or Paxlovid, these are all antivirals. Whereas Theraflu, I think it has ingredients such as Tylenol, acetaminophen. It may have some other ingredients as well that would give you some symptomatic relief, but they won't attack the virus per se.
Okay. Oh, that's
yeah. Theraflu is very similar to like NyQuil or Dayquil in terms of the ingredients that are in it.
Okay, so it's going to help with the symptoms, but it's not going to kill the virus.
Exactly.
Okay, that's very interesting to know. We have another question. For someone who cannot take the vaccine, are there other ways to boost the immune system?
Sure. So generally speaking, I think that's a great question. I think we should all work on that to boosting your immune system. Yes, there are natural ways, i.e. you should always have a balance and a good diet. You should sleep well. You should certainly exercise. If there's any quote unquote bad habits, alcohol, cigarette smoking, or smoking something else, you should certainly avoid that. Those are all shown to depress your immune system. Maintaining a good weight, I think that might be another way to boost up your immune system. So yes, all these things are very helpful in fighting the infections, including COVID and flu infections as well.
Are there any precautions? Go ahead.
Sorry, just to add on to that, in addition to boosting your immune system, of course, wearing a mask. That's probably, one of the most effective ways to help spread infections, as we have learned over the past few years.
Yeah, thank you, Sonia. That's exactly what I was going to ask, like if there are any precautions, especially if you know that you didn't take the vaccine and your immune system might not be that strong, if there are any precautions that we can take. And I see, more and more people are walking around without a mask or anything like that. I used to see hand sanitizers everywhere, not so much. So I know the fear is going away, but I think for people, especially those who are not taking vaccines, I think it's very important that they keep those precautions. So we're mentioning face masks, hand sanitizer, anything else?
So one thing that we were doing was social distancing. I think that's still an effective way because these viruses, some of these cold viruses, respiratory viruses such as COVID and influenza and others, they only travel to a point, so they won't travel more than 6 feet away. So if you're coughing, the virus will only travel about 6 feet. So that's why one of the recommendations when the virus was discovered was social distancing. So, I mean, if it's possible, try your best to socially distance as well.
Now let's talk a little bit about the timing of the vaccines. And one of the questions refers to that. Will the COVID booster be required to be taken every year? Flu is every year. COVID, we had it like, I don't know, it's like, I know I had it 3 times already, but maybe a 4th, I don't know. So what will be the schedule for both flu and COVID vaccine?
So as we speak, research is being done on this. And I think that in itself is a testimony that, they're just not making up these recommendations. They're doing proper research. They're studying this constantly, and then they're coming up with recommendations once this is adequately studied. So as of now, there's not a recommendation as of yet. There was a recommendation for people who may have a compromised immune system, people who may be of a certain age, they should be getting it every 6 months, but it's not become, mainstream recommendation as of yet. So I think in the next few months, like I said, the research is being done as we speak right now. They'll come up with more clear guidance on that, and we'll make better recommendations. The feeling is it may be a yearly vaccine, but again, stay tuned. We will certainly update everyone once we get some more information on that.
Yeah, just to add on to that, I think that there's the reason why we have to get a new flu vaccine every year is because, as I had mentioned before, viruses keep changing, right? So every year they have to come up with a new flu vaccine to target the viruses or the influenza virus that they think that we're going to see the most of during the flu season this year. That's also why with COVID that we've had to get so many vaccines, and why they just came out with a new booster, is to really target the 2 most common COVID strains that we're seeing now that we didn't see at the start of the pandemic. So it really depends, they're doing a lot of research, as Dr. Chalk was saying, and it really just depends on how long our body is able to maintain that immunity with the current vaccines that we've already gotten. And then also based on the strains of the virus that we're now seeing in the community, which are going to continue to change as they, become more resistant, and they kind of viruses find ways to become more, to keep changing so that, they're always keeping us on our toes. So, so based on all of that, that'll really determine what the future of the necessity is going to be with the COVID vaccine, at least.
Sonny, that's very interesting to me, like that whole mutation thing. So do they change so that a new form of the virus appears while the older ones disappear? Or the older ones are still there, but because we are vaccinated against them, we don't get sick from them. And then we are adding more new ones?
So, as Sony mentioned, flu vaccine does have a tendency of changing. So I don't know if you recall, probably about a decade ago, there was that so-called H1N1 virus, which was a respiratory virus. The other name was swine flu of that. So not to get into too much details, but H and N, those are the two components within the virus. And there are, I believe, 11 of the H and 7 of the N. So there could be another virus which may be titled H5N1 or H7N3, so on and so forth. So those are the mutations that are going on in those two components. And yes, on a yearly basis, either the H will change or the N will change. So that's why you can have a slight variation of those virus. And again, I'm trying to overly simplify it. And as Sony mentioned, what happens is they see what type of virus was in Australia because their winter months are a couple of months before us, and based on that, they'll come up with a vaccine that they will predict that's more beneficial and more effective against the virus, and that's what we would release to the public.
Mm-hmm. Sounds like the Apple phones, right? The 10 to 11, like every year is a new one.
That's right. That's right.
Sorry.
Yeah, I mean, that doesn't necessarily mean that the old viruses have gone away. It just means that, this is what we're seeing more of now, and that's why we want to target it. So, maybe they did go away. It's really hard to say. We're also not testing every single person to see what strain of the virus they have, right? So it's hard to say that they've completely gone away. But, all of these vaccines really just target what we're seeing most of at the time.
Is there any danger on getting so many vaccines?
So is the question if it's dangerous to get a flu vaccine every year or other vaccines as well?
Yeah, I guess, I've heard from people out there saying, oh my God, what is going to happen to our bodies because we're putting all these vaccines in our bodies, and 3 of these, more of that, then every year a different one. So is there any danger to doing that?
So the vaccines have been around for, they became more mainstream for probably about a century now. And you could see an inverse relationship between life expectancy and vaccines. So i.e., life expectancy used to be really short before the vaccines were introduced. When the vaccines came out, you could see life expectancy has increased by about 20-25 years. And more importantly, the quality of life. You don't see people with polio, for instance, anymore, where they have full neurological deficits. You don't see people, with flu or a whole population of people being eliminated, just like we saw with COVID when COVID started, a million plus deaths in just a short period of time. So when these vaccines were introduced, that's what we saw. I mean, the quality of life got better, the life expectancy got much better. There has been numerous studies, like for instance, people have always been reluctant about childhood vaccines, for instance, that they may cause autism. So fortunately, that's been debunked. There's been multiple studies done in multiple journals that have shown that vaccines do not cause autism. So just to keep that in mind, I think again, what we would encourage you to is go to the people who have been dealing with this on a regular basis and the people who have done the proper research on this. So yes, in a nutshell, these vaccines are safe.
Very good. I love the answer about, we're living longer. If that doesn't prove it, then what does, right? We're definitely living longer. How soon after COVID can you get boosted? And do you also have to wait to get your flu shot after COVID?
So the current recommendation for getting the booster vaccine after getting COVID is you can wait up to 3 months. You don't have to wait, but the thinking is that your body has probably created enough immunity from you actually having COVID so that you don't need to get the vaccine right away. There are people that have gotten COVID multiple times. And, even during this time where we're seeing like, the same strains, I definitely know people from personal experience who have gotten COVID twice in a matter of 2 months, very recently. So, the recommendation is that you can wait 3 months after getting it, but you can definitely get it sooner. And in terms of getting the flu vaccine, there's really nothing they're two very different viruses. So just because you've had COVID, that shouldn't stop you from getting the flu vaccine.
Mhm, mhm. And I think I didn't ask this question yet. Will the COVID booster be required to be taken every year?
So as we addressed it, like the research is being done at this point. So stay tuned. Hopefully soon we'll have a better understanding on that. Personally, I think that's what we're leaning towards, but again, I can't.
Mhm.
I mean, it's not just based on personal opinion. It needs to be backed with the proper research. So once the research is completed, then we'll have a better idea, and we'll let everybody know by then.
And again, I think you just said something beautiful. It's not based on personal opinion. I think that we need to put that in bold letters because that's what we see out there, right? A lot of people just saying what they think or what they believe on, and we're not looking at the science to make decisions. And there is a lot of science, a lot of research that really supports what we're saying here today. So you can be very affirmative of what we are saying here and spread the voice. If you know people who are still fearful of taking the vaccine for COVID, for flu, or any other type of vaccine, we know what we're talking about here. So just let them know or invite them to watch this community chat so that they learn as well, because it's a lot of people out there, unfortunately, misinforming the audiences, and that's what's causing a lot of problems as well, right? And health problems too. Okay, we have another question. Has there been any research on the 40% of people who have been asymptomatic with COVID and what factors contribute to this?
I think they're just coming up with different theories, but nothing is really substantiated. I think people are still somewhat. I'm sorry, was it about COVID or flu? It was
COVID.
COVID. COVID. Yeah, I don't think anything is substantiated. But as we discussed before, I think we should just do what we can do, i.e., to boost your immune system, as we had answered that earlier. Just have a proper balanced diet, exercise regimen, control your weight, avoid all smoking, alcohol, and whatnot. So I think that's what we can do. But I don't think specifically there has been anything that's shown why certain people are affected or infected much worse than the others are.
Now, there are indeed have been some cases of people who have had COVID and they've been asymptomatic. But what about flu? Are there cases like that as well?
So flu would be the same way. Some people may be mildly symptomatic, and some people, for some reason, get severely symptomatic. And that's somewhat baffling as well. I mean, one of the theories was we've seen younger population becoming much more severely symptomatic, whereas the elder population isn't. And that may stem from the fact that, as Sony mentioned, these viruses may not completely go away. There's that H and N that we said where it changes every year, but at an older age, you probably have had numerous exposures to it, and you've been numerous vaccinated with it, so that may protect you.
Yeah, that's great to know. The more vaccines you have, even better. Look at this, there is proof for that. Okay, I don't see any more questions and we are about to end our time here. So any further thoughts or any closing remarks, Sonny?
I feel like you're putting me on the spot here. I guess my closing remark is go get vaccinated.
Thank you, Dr. Chuck.
Same. Yes, please
Mine
get
is please,
Yes,
please
no,
go
please.
get your vaccine. Where can people go for vaccines?
You can go to your local pharmacy. I believe all of the pharmacies in the area should be carrying both the COVID and the flu vaccines.
Mhm. One last question, because this always comes up, and I was going to ask it earlier and I was forgetting. Pregnancy. Is pregnancy a contraindication for getting vaccinated?
It is not. It is actually recommended to get the flu vaccine during pregnancy. With the current booster, they actually don't have any formal recommendations on whether or not to get the booster. So it's really up to the individual. My personal opinion is that, you know, if you're pregnant and you plan on breastfeeding, then if you are vaccinated, then you can pass on some of that immunity to your baby through breast milk. So I am a supporter of getting the vaccine even while pregnant. But as per like any formal recommendations through like the, you know, like the like ACOG, which is the American College of Gastroenterology, or not gastroenterology, sorry. Yeah, there we go, obstetrics and gynecology. They don't have any formal recommendations at this time.
Mhm. Oh, but I love what you just said. Like you can pass some of that immunity to your baby. How beautiful is that? And especially in the breast milk. That's nice. Dr. Chuck.
Yes, I think Sonia is speaking from personal experience as well. So because she's going through that right now. Yes, absolutely. First of all, as you said, please get vaccinated. It's in fact, pregnancy is more for reason to get vaccinated because now you're protecting two lives, your own and your baby's life. They're considered very safe during pregnancy. That's what numerous research articles have shown. And as I said, it becomes somewhat more for reason to get vaccinated. In fact, pregnancies in some cases has been considered a high risk for flu, so that's why it's more for reason. And as we stated earlier in our talk, the more that you get vaccinated, you could see the quality of life and life expectancy getting better as well.
Mhm. Well, I think you put it beautifully there. Please protect your life. Please protect the life of those that you love. Get vaccinated. I mean, for those rare instances of life, you shouldn't get vaccinated. Then protect yourself and protect others. Wear your masks, wash your hands, use hand sanitizer, keep distance at least 6 feet among each other. And we're going to keep living longer and longer. I hope, you know, and the more vaccines you get, the stronger you are and you're going to be protected. So thank you so much, Sonny, Dr. Chuck. This was great today. And I'm really hoping that we encourage a lot of people who, you know, weren't sure about yay or nay, that it's all yes, and let's do it. And next week, we're going to be talking about sleep disorders. A lot of people out there don't sleep enough, or they want to sleep, but they just can't sleep. So we're going to be talking next week about why that could be. Don't miss on the answer to that question. If you're not sleeping well, this is the community chat for you. See you next week. Thank you all.
Thank you very much.
Thank you. Thanks for having us.
Bye-bye.